Oh, Dan, what's going on?
Oh, I'm really dizzy. I just got up and turned my head like towards the left, and the room starts spinning. Like I might throw up.
Oh my gosh. You know what? I think you're having vertigo. BPPV. Let's talk about it. What's going on, YouTube? It's Dan. It's Ken. It's Dan and Ken PT. And today, we're going to talk about vertigo and how to treat it.
Okay, anatomy time. So the picture you're looking at right now is the inner ear. So the inner ear, you have three semicircular canals, the anterior, posterior, and lateral. So within these canals, it's filled with fluid, and then it's kind of lined with some small calcium crystals, which we'll talk about a little bit, what happens to those crystals and how it relates to vertigo. So the way this system works is the fluid, you move your head when you're walking or you're turning your head, the fluid in the canals shift, and then all the cells within the canals send signals to the brain, and your brain then turns those signals into information and lets you know where your body is in position. So that's how you stay balanced.
Thanks for that anatomy lesson, Dan. Great work. So yeah, as Dan said, there are three canals in your inner ear. Now the posterior canal is usually the most common place for a crystal or otoconia to get lodged into. And when that happens, your body thinks that it's moving, but it's actually not, hence the dizziness. And Dan, what's it called? Nystagmus, right?
Nystagmus is when your eye kind of beats towards one direction, and there's tests that we perform where we can look for some nystagmus and kind of determine which canal is affected and what to do from there.
Yeah. Guys, don't be alarmed if you ever do get vertigo. I had it a few months ago. It is scary. I woke up with it and the room is spinning. It's very intense, but it is treatable. So now I'm going to show you an Epley's maneuver. Here's how an Epley's maneuver looks in real life. So I have these pillows here to give me an angle to tilt back. So let's say your symptomatic side is looking left. So first you're going to look left 45 degrees and go back. Okay, now if you were symptomatic like I was a couple months ago, your eyes would be going back and forth and you may get dizzy, so have a bucket nearby. But just try to push through. If you're dizzy, that's okay. Don't be scared. It'll go away. At least 30 seconds. After 30 seconds, you're going to turn 90 degrees to the right. So you're at a 45-degree angle. Hold that for 30 seconds. After that, you're going to turn to the edge. Look at an angle towards the ground at 45 degrees for at least 30 seconds again. It's very important to hold these positions for at least 30 seconds so those crystals could go back where they're supposed to go. And then after 30 seconds, you're going to sit back up and just look forward. Take some breaths, get used to the position. You could do that once or twice a day until you're asymptomatic, guys. Guys, we hope you liked the video. If you did, give it a big thumbs up and subscribe. We really appreciate it. If you have questions or suggestions, please email us at danandkenpt@gmail.com. We have a shout out today for Jessica Soros. She's a physical therapist and she works with neurological conditions, vertigo, BPPV, and she helped me when I had vertigo. So big shout out to her. If you're in the Illinois, Chicagoland area, reach out to her, Jessica Soros at Illinois Bone and Joint Institute. Guys, seriously, never forget this. Never forget to
Live,
laugh,
love,